Hello, so our topic for our video project was contraception, and because there are more than one methods of contraception, we went with the most effective one, which would be the birth control pill. And for my individual presentation, I went with the focus topic of like the positive and the negative consequences. But to make it more appropriate to this topic, I kind of switched it and made it the negative side effects of taking the pill. So that is what I will be presenting to you today. So to start off with, some of the most common side effects for women who take the pill are changes in their sexual desires. So because in the pills there are so many hormones, and the body are not necessarily used to them or taking them in such big doses, the body will kind of decrease the libido or the vaginal lubrication of women. So one of the hormones, the progestin in the pills, will kind of decrease the production of like mucus in the vagina, which means that's what basically decreases the libido or the vaginal lubrication. Some women may also experience some mood swings or some mood changes. That also has to do with all the hormones that are in the pills. Some may cause some unwanted spotting or some bleeding between the periods. So even though the pills could be taken for regulating your menstrual cycle, they could cause some bleeding or some spotting in between your periods because the body is simply trying to adapt to the pills and the hormones. So it's basically just sometimes it'll secrete some little spots of blood just because it's some that was left over from your previous periods. So some women might also experience some swelling of the breasts or some sore breasts. So meaning some women, their breasts might even grow. So some women might be very, very happy with that. In some cases, it may also increase hair growth. That doesn't happen in all women. It's a very specific case of the hormones interacting in your body that could cause some increase in hair growth. Some more very common side effects of taking the pill for women would be like having nausea, some headaches, some possible weight gain. If women do gain some weight when they start taking the pill, they will lose it. It's not weight that they will keep forever. It's just, again, due to all the hormones being adapted in the body. That's creating just some extra fat. They can also, in some women, some cases, the pill could also reduce fertility in women. So that's also another very special case because it could just be happening in women who had some, like before starting the pill, had some infertility or had low levels of eggs. So the pill is just like adding to that infertility already. It doesn't mean that fertile women will get infertility by using the pill. Another side effect that could be that pretty much sucks, we'll be honest, is that the pill is very expensive and you have to buy at least a pack per day. So one of the packs like these, if you can see them, you have to buy one per month for them to be really effective. Not per day, sorry. And you'll see it gets very expensive since you have to buy one every month. Now these side effects are only there in the first 3 months of taking the pill. So when you first start taking the pill, in the first 3 months, you could experience these side effects. Not every woman experience these side effects. For a matter of fact, some don't even experience them at all. Some might experience them all. It really just depends on how your body is adapting to the pill and the hormones. The pill should not be making you feel sick or uncomfortable. For a matter of fact, if it does, then it should means that it's not the right brand for you, and it just means that you should be switching brands. On another note, there are more severe side effects to the pill. So some of them are blood clots. You could have heavy or more painful menstruations. blood pressure, cancer, endometriosis, and menopause symptoms. So these are more occurring in women who mix their birth control pills with, let's say, alcohol, tobacco, or other drugs. They could also be more common in women who have, for example, past family histories of blood pressure or cancer. So it doesn't mean that any woman could get these severe side effects. They're usually very not common. And so therefore, what women really need to be careful about is just making sure that they take one pill every day for it to be very effective and for them not to get these side effects. Because that would just mean that their body is getting the consistent amount of hormones. And another side effect also would be getting pregnant. So if you're not taking your pill every day and you're forgetting some, then there's a possibility of you still getting pregnant. So we have to be careful with that. And these are my references, and that is it. Thank you.